Prescription. Prescription is an order written by a physician, dentist, veterinary surgeon or any registered medical practitioner to a pharmacist, to compound and dispense a specific medication for the patient. Prescriptions are written in English and Latin terms. The order consists of the directions for the pharmacist about type and quantity of the drugs to be prepared. It provides information regarding dosage, mode of administration and duration of the drugs. The prescription provides link between the physician, the pharmacist and the patient. Parts of prescription. A typical prescription consists of date, name, age, sex and address of the patient. Superscription, inscription, subscription, signatura, signature, address and registration number of prescriber. Parts of prescription. 1. Date must be written on the prescription by the prescriber. The date on the prescription is important and must be recorded in the dispensing register. The date on the prescription helps to pharmacist to find when the prescription is issued by the physician. Because the prescriptions should be filled within a reasonable time after it has been issued by the prescriber. If the prescription is brought for filling after 2 or 3 days from the date when it is written, the pharmacist can question the intention of the prescriber and patient. This type of observation are very important when the prescription containing narcotic or habit-forming drugs. 2. Name, age, sex and address of the patient. The full name, age, sex and correct address of the patient help for the identification purposes. The detailed information of the patient avoids the possibility of issuing the finished product to any other person having the same name. The exact age and sex of the patient is also necessary in the case of children. This helps to check the medication and dose. This is particularly useful when a child has the same name and having different disease condition. The address of the patient is required for any reference in future or any other inquiry. 3. Superscription. The superscription is represented by a symbol Rx, written at the beginning of prescription. The symbol Rx is from the Latin term, recipe, meaning take thou or you take. In the days of mythology the superscription symbol Rx considered as a prayer to Jupiter, a sign of god Jupiter, the god of healing. In the ancient days the symbol was employed in requesting the god for the quick recovery of the patient. Today the symbol is representative of both the prescription and the pharmacy. 4. Inscription. Inscription is the main part of prescription order. This consists of the name and quantities of the prescribed ingredients. The names of the ingredients are written in English each on a separate line. Along with this the quantity of individual ingredients and the last item will be the vehicle or diluent. The complex prescription containing several ingredients and the inscription is divided into 3 parts. A. Base is the active medicament intended to produce the therapeutic effects. B. Adjuvant are included to enhance the action of the medication and to make the product more palatable. C. Vehicle. Used to dissolve the solid ingredients and to make up the preparation to required quantity. Nowadays the majority of the prescriptions are written for medications already prepared into dosage forms by pharmaceutical companies. The pharmacists are only required to dispense the ready drugs. 5. Subscription. The subscription is prescriber's direction to the pharmacist regarding the dosage form to be prepared and number of doses to dispensed. Usually this will be written in Latin language. For example, fiat mistura, midi 3 fluid ounces, means prepare the mixture and send 3 fluid ounces, 90 milliliters. 6. Signatura. It is abbreviated as sign on the prescriptions. It consists of the directions to be given to the patient regarding the administration of the drugs. It indicates the number of doses or dosage units to be taken. It includes how many times in a day or at what time it should be taken. These instructions are given in Latin language and must be transferred to simple English. For example, cochlear magnum, ter in die, anti-chibos, sumendus, translated as 1 tablespoonful to be taken 3 times a day before meals. 7. Signature, address and registration number of the prescriber. This part of the prescription is very important. This is authentication of prescription. It is written by the prescriber personally. The prescriber's name must be handwritten and should be signed with ink. This eliminates the danger of dispensing medicament on a spurious order. The prescriptions containing narcotic or other habit-forming drugs must bear the address and registration number of the prescriber. Handling of prescription. Physician writes the prescription and hands over it to patient. The patient carries it to prescription department and hand over to pharmacist. Now it is the responsibility of the pharmacist to carry out the formulation and dispensing of the medication. The various process including in the prescription department is known as handling of prescription. The handling of prescription includes receiving. Reading and checking. Collecting and weighting the materials. Compounding. Finishing. Handling of prescription. 1. Receiving. The prescription should be received by the pharmacist. Any unauthorized person should not be allowed. Sometimes an emergency may communicate through telephone directly by the physician. 2. Reading and checking. The prescription must be read briefly from beginning to the end. This gives an idea about the nature of the dosage form to be prepared. This helps to estimate the time required for preparing the medication. This gives an opportunity to study the information of the patient. Careful examination of the prescription is required to clear the doubt regarding the ingredients, directions and dose. If there is any doubt regarding dose and ingredients, the physician must be consulted. The pharmacist should not show any expression to the patient regarding the doubt in the prescription. The pharmacist can refuse to dispense the prescription due to the reason like the ingredients are not in stock, essential information is missing or doubtful, safety of the prescription is doubtful. 3. Collecting and weighting the materials. The required material should be collected from the main store. All the materials are weighed accurately and labeled. The materials are arranged according to the requirement of their use in the compounding. 4. Compounding. This is the most important step in handling the prescription. It is the responsibility of pharmacists to dispense the drug in a suitable form. The following points are necessary to achieve the perfect formulation. The prescription department should be clean, near and well ventilated. Neatness, accuracy and speed must be maintained. Personal care should be taken to minimize the mistakes. Correct procedure should be designed before the formulation. Only one prescription to be compounded at a time. Making more than one prescription at a time may lead to serious mistakes by dispensing wrong drugs. 5. Finishing. The formulated medicaments should be filled in suitable containers. The container should be suitably labeled immediately to avoid the confusion. The following information should be written on the label. Name of the prescription. Name of the patient, age, date. Physician name and registration number. Date of dispensing. Directions for its use. Expiry date if required. Storage conditions. Name and address of the pharmacist. The label should be placed on the correct place of the container. Special directions like, for external use only, and, shake the bottle before use, must be written and checked properly. The finished product container should be polished and handed over to the patient.